So we're getting ready to start the chiropractic panel. We will start now. So thank you guys, first of all, for attending. In chiropractic practices, there are a lot of nuances. So one of the things that we really want you guys to understand and really highlight are the different nuances that each of these different chiropractors have. So each of them does their practice in a little different way. They'll focus on different things. They'll focus on different features. So listen to what they have to say. And this is important if you're looking for a chiropractor. You want, somebody who kind of matches your vibe and all that. So with us today, we have Dr. Clayton Lowe. We have Dr. First name is Justin McGinn. And we have Dr. Candice Dalek with us today. So we're going to let each of them talk a little bit about their practice to let you guys know what they do and how they do it. And then we're going to drill in and ask them some questions, which will be fun. But we'll start with Dr. Lowe, and then we'll just pass the microphone to Dr. McGinn and then Dr. Dalek, and we'll go from there. So Dr. Lowe, tell us a little about your practice.
My practice, I've been in practice 28 years. I practiced in Iowa for 25 and then moved down to Oklahoma City 2 years ago. And then our office here is basically your simple chiropractic office. We do adjustments, we do some acupuncture, we do some therapy, some stretch, things like that. But the primary thing is we want to know what's going on with your health. And so one of the ways we do that is we take x-rays and find out exactly what's going on. And then we come up with a plan of course of action for you to follow so you can get better.
All right, Dr. McGinn. Hello, my name is Justin McGinn, chiropractor in Edmond, Oklahoma. We are a multi-generational practice, so we have had, we started about 50 years ago. We were the second chiropractor in Edmond when Dr. Ryan's dad started in practice, so that's fairly cool. But we focus on health from a neurological standpoint. We want to make sure that your brain and your nervous system are functioning so that all the organs and everything, it's not always just about pain. We have some things that we do to help with pain outside of that, but chiropractic's our main focus. But then we do a lot with spinal decompression. We have a shockwave machine here with us today if you want to come experience that. We do some class 4 laser, some other things like that. Chiropractic is mainly the thing that we want to emphasize and what we're going to be talking about today, though. So thanks for coming.
Hello, my name is Candice Dalek, and I own Aspire Wellness Living. I do different types of chiropractic. I do dry needling, acupuncture as well. We do nutrition. So I do 20 to 30-minute adjustments. So we do myofascial tissue work before we do administer the adjustment.
All righty. So we've gotten a little bit about what each of these chiropractors does and a little bit about their practice. We're going to drill into some questions. So we're going to talk a little bit about prevention and performance. And the first question is going to be for Dr. McGinn. So Dr. McGinn, what can optimizing function look like for an everyday person, not just for a professional athlete?
There's two ways to answer that question. I think with professional athletes and the very sick, they're going to see the most results because they are on that edge of both the spectrum of health. So it's one person is very, very sick, having a lot of issues. We go in and we start optimizing their nervous system. They start seeing that things are getting better in terms of headaches or asthma or any number of things that are systemic. And then you have the professional athlete that's at the very top of their game. And when you give them a neurological edge as far as the way their body adapts to the efficiency of the nervous system, they see an improvement that is, what's the difference between $3 million in a horse race? It's about half a nose. So it's like they are looking for that performance edge, and they'll notice that. You can adjust me, and my golf game does not improve to a noticeable, thing because I'm not at that edge on my golf game. But I do notice that asthma is actually what got me into chiropractic. is I was just a normal kid. I was having asthma, drugs, and surgery, and all the things they were telling me I was going to need for my whole life. My grandma finally took me to the chiropractor, and that's when I started noticing a difference. And so for the average person, sometimes it's harder to see, but it's still working. The principle is there. The nervous system controls every system in your body, and you want that to be functioning as well as it can.
Very good. Very good. Dr. Dalek, what can people do outside the chiropractic office to support their overall wellness?
That's a good question.
Outside the office, I suggest nutrition, but it's a daily lifestyle that you have to choose. So exercise is important, infrared saunas are important. I think looking at your gut biome is extremely important. That's going to help the brain. It's going to help the inflammation process. So there's many, many different things that you can do besides the chiropractic office.
And Dr. Rao, why shouldn't someone necessarily wait until they're hurting to think about how their body is functioning?
Okay. Well, when you think about it, your nervous system controls everything in your body. And it's not just pain fibers. Only about 10% of the fibers that come out of the spine are actually pain fibers. So if you're not feeling it, it could be affecting other things. It could be affecting your muscles. It could be affecting your organs and things of that nature. So you might be having other symptoms or some subclinical symptoms. You know something's wrong with, like, your stomach, for example. And instead of taking Prilosec or whatever it is, you want to make sure that that's better. So by getting regular adjustments helps improve that, right? But it's more of, we brush our teeth every day. Do our teeth hurt? Hopefully not, right? But we brush our teeth every day so they stay healthy. The same thing with our spine and our health. If we get adjusted on a regular basis, our nervous system is going to function better.
All right, can each of you take just a little bit, so we'll pass the mic down, but just take just a second and talk about what makes your practice unique. So what do you do that's unique, that's a little different than every other chiropractor? And also, like, when would you look for, like, help between each other? So would you ever, cross-refer patients and things like that? So, yep. We'll start with you.
Okay. Well, my practice is a little different. We do what we call open bay adjusting. So the table's right out there in the open, so everybody can see what's going on. There's nothing hidden. And my music is, I've been told, a little loud at times, but we do that just to keep the energy up and keep everything going. As far as referring to other doctors, I refer to these guys because I don't do shockwave in my office or decompression, so I'd refer to Dr. McGinn. And if somebody needed dry needling, I do acupuncture in my office, but it's electronically. But if somebody needed dry needling, for example, I'd ask Dr. Candice to take care of them.
Very cool.
So my office, we're a little different in that we do instrument adjusting, which means it's not as hands-on the way someone might typically think of chiropractic. Very gentle, very neurologically focused. We're looking for, instead of one big force, we're putting in a bunch of tiny inputs. And the brain seems to connect with that, and it helps the body make that correction. The other thing, like he said, we do a lot of shock wave and laser and decompression in addition to what we do chiropractically. But as far as going to different chiropractors, there's some people that absolutely love what we do, the more gentle approach, and they wouldn't be happy in another office. I have people come in that they want that. I'm not going to try to force that. I'm going to say, this is what you're looking for, this is where to go. Sometimes it's just a personality thing,
Yep.
Not everybody likes us, and for whatever reason, because my shirt's black and they don't like people with black shirts, so they need to go to somebody with a blue shirt. I don't always know, but we're happy to refer that over. So personality issues can be a one, but it's we're all working together. Like, all of us have the same mindset in that we're looking to get the community of Oklahoma City, Edmond, and the surrounding area to a healthier place, because that's ultimately better for all of us. If we're in a healthier community, we're in a safer community. If we're in a healthier community, we're in a more productive community. And so we're here for you, and we want to find you the best place possible.
Aspire Wellness Living is different because we are a home-based office. We spend 20 to 30 minutes with each one of our patients. We look at the whole body as a unit, so we're doing the myofascial as well as the adjustment, the acupuncture, and the dry needling. So we spend a lot of time with the patient, and we intentionally do that.
So let's just, this is working pretty good. Just pass the next up. Rather than
Seems to work.
you individual questions, but can you each talk a little bit in your practice about how you would handle children? So is kids care different than adult care? And then can you also talk a little bit about, are we cracking people, and does there always need to be a pop when you adjust somebody? So let's start with Dr. Dalek this time, and then we'll work at this. Dr. McGinn always gets to be in the middle, so it's kind of nice.
A child chiropractic adjustment is a lot different. It's more like craniosacral therapy. It's very light. You don't really need to pop a young child's vertebrae. I don't even need a pop from an adult. So I do feel that the energy of the adjustment is sufficient to be able to feel a difference. What were the other ones?
And the pop and crack.
Yeah, so I just.
Oh, okay. Sorry, kids. I can't hear kids. No, go ahead. Did you just talk about kids? Okay, very good.
So in a lot of ways, kids are just tiny people, right? So we treat them very much the same. Little difference in amount of force that's needed, little bit difference in the even amount of time. They're more resilient. They haven't been carrying these same issues for 40 years by the time they come in to see me, so that makes it a little easier working with kids for sure. We do instrument adjusting, so we're not getting the loud audible crack that you might hear in a normal office, but neurologically we're firing the nervous system, and that's the main thing. If you're getting a neurological connection between the brain and the part of the body that's disconnected and not moving correctly, that's all we're looking for. You can do that a number of ways. And then there was another part of that question, but we talked a little bit about.
You got it all. Yeah,
I think I got it all. Thank you.
And I can't hear.
we can't hear anything. So the pop is just a release of pressure within the joint. Okay, so you don't need that big pop to get an adjustment. A vertebrae only rehabilitates about a few millimeters at a time. So you don't need that big pop for an adjustment. You just need that stimulated the nervous system, get that joint moving again so it will start functioning better. As far as adjusting kids, it's the same principle as they said. They're smaller people, right? And so there's different techniques we use, different styles. We just don't throw them against the wall and see what sticks. But by adjusting kids, a lot of times the pressure is just the amount of pressure it takes to move a pencil across the table. And so, or roll a pencil across the table. That's about as much pressure as you actually need, whether it be with an instrument or your hand. It's just a little bit. And sometimes kids will pop louder. And so you just say, well, you're full of popcorn today, and just make it kind of fun for them.
Thank you, guys. And so now in the medical profession, let's say imaging is becoming more and more important. So how do you guys work with, do you work with images? How are you getting your, let's say, diagnostic information for your care? So let's talk a little bit about that. And Dr. McGinn, do you want to start? You can choose.
Your turn.
Yes, sir.
Okay, as far as imaging goes, there's a few different ideas on that. I think ultimately as chiropractors, we trust our hands as much as we trust anything. Everything else is just added information to what we do. In my office, for instance, we do thermal imaging to start out. We do x-ray as well because we want to have a good overall map. And then the day-to-day visit may be using my hands to see what what is the stress of the day that we're going to be working on, but we also have a global map of structurally what do we need to do. The function of your nervous system is directly related to the structure of your spine. And so if you have a lot of pressure on there and we don't have a way of measuring that or knowing what that is, sometimes we have a hard time demonstrating that. I like to do before and after x-rays, especially in the beginning. We got to check our work. If I say I'm going to help you get a curve back in your neck, we want to see if we're actually moving in that direction and getting that. So we use a few different images. MRIs are great. I don't always refer out for them, but occasionally you need to. We have instances where that's helpful. A lot of people bring that stuff in if they're having disc issues and those kind of things. They've seen somebody else, and it's helpful for us to have it. I still want to see an X-ray, even if I have an MRI report, just because I want to see where the bones are lined up and what we need to do.
I don't start out with X-ray in my office. I do more of a muscle testing technique. If we're not getting results, I do refer out for X-ray, and I also refer out for MRI.
We take x-rays when you first come in. We're looking for those curves. We have 3 natural curves in our spine, and those curves are there to one, act as a cushion against gravity, because gravity always wins, but also it allows us to stand upright. If we lose one of those curves, our body becomes more prone to injury. And so by having those natural curves, that's what we take those x-rays for primarily. Plus we want to see how straight you are, in a sense. There's no health in crooked, so you want to make sure things are lined up the way it is, so there's less pressure on the spine and less pressure on that nervous system. So we refer out for MRIs if needed, and ultrasound or whatever, but typically the x-ray is the primary tool that most chiropractors will use to use for diagnosis.
Okay. We're all passionate people, right? So you guys got into chiropractic because you wanted to help people and you were passionate about what you wanted to do, right? So can you talk a little bit about that passion that you guys have for what you do for your practice? And also talk a little bit about, if you could have your wish, if you could have any toy or any service or anything, make a wish that you could bring into your practice, what would it be? And we'll start with you, Dr. Lowe. Dr. McGinn looked like he had it all ready to go.
He's ready to go.
If you're ready. Yeah.
I think passion-wise, all of us have come into this for different reasons. Some of us have a profound health experience. Like for me, it was asthma, and that's what got me on that path. But it took me years to find my way into a chiropractic school from when that happened. Did some other things. But the passion for what we do is really helping people experience things. If people knew what we knew, you guys would all be in there, and you would have your kids. The importance of what we do, the philosophy behind health of your nervous system as a primary thing. There's nothing else in the body that can tell your body what to do other than your nervous system. It's one of the very first things to develop as from conception. One of the very first things we get is this communication system that says, hey, this cell needs to become this, and this cell needs to become this. That's one of the very first things that happens. And throughout life, that is what we are trying to maintain. Kids are replicating at a higher rate than we are as adults. So do you want your kid to grow healthy, or do you want them to grow sick? You want that nervous system making those decisions based on optimal feedback between their brain and what's going on, so they can make those things. So that was my big thing.
Good. Well done.
My passion all started whenever I continuously had migraines whenever I was 20 years old. So I decided that I needed to go see a chiropractor. And so the chiropractor helped me with my hormonal migraines. And then at 2 years old, my daughter was diagnosed with severe asthma. And I knew that the drug and pharmacy wasn't going to be able to cure her or help her. And so I looked into chiropractic for that, as well as naturopath. I have also helped my son with brain inflammation, autism, and Candice. And so that gives me the passion to be able to do nutrition in my office and all the testing that is needed for that.
Cool. My passion kind of in chiropractic started was with sports, and I had a shoulder injury and saw a chiropractor, and he helped me get over that. And so we went into chiropractic school, and it's my passion has kind of evolved in a sense, but it's still primarily taking people that are not performing well and making them better, whatever part in their life. And when you see that, when they get to that point where they all of a sudden they realize, oh, I'm not hurting, or when you have the mom who had difficulty getting pregnant and she comes to you and says, I'm pregnant now. That's, those things like that kind of help feed your passion because you're actually making a difference and helping people. But yeah, mine started off in sports and taking care of athletes, and it's kind of continued that way.
Okay, so next question is going to be biggest miracle. Biggest miracle that you guys have seen in your, anybody who does clinical care and kind of, let's say, helps people with a practice has seen some truly miraculous healing and things come as a result of care. So, biggest miracle, we'll start with you, Dr. Lowe.
I had a child years ago, and the medical doctors were not able to help this child because it was a failure to thrive, and the child was not growing. And so through chiropractic care, fascia release, we were able to continuously see this child thrive as well as grow, and it grew pretty quickly.
I think my biggest miracle are the ones we don't see. Like, I would much rather take care of a healthy person from birth through life and then not have a crisis for me to have a miracle with. And so those are the ones that I think mean the most. One that actually came back that's maybe outside of the realm of what most people think of as chiropractic. Adjusting somebody in one of my practices and for a long time, and he came in one time and he said, I don't know if you know this, but I was planning on killing myself before I came and saw you months ago. And this has totally changed my life. And it's like, you don't always know what's going on in somebody. They may tell you about their shoulder pain or back pain or whatever it is, but there's other issues, and the nervous system is the biggest part of that as well. It's how we handle stress. It's how we deal with emotions even. And so that one hit me pretty hard because it's like, okay, this just upped the game for me. This is more important than maybe I even saw it. And that was fairly early on in practice for me too. But
yeah, well done. I had a lady, a midwife, one time call the office, and her patient was the water had broke, but the baby was breech. And so I said, yeah, bring her in. We can adjust her and do acupuncture. And so she came in right before lunch, and it's probably the most uncomfortable looking woman I've ever seen in my life. And we adjusted her. We did a couple acupuncture points and sent her on her way. I got a letter in the mail that tells you how old I am. It wasn't an email. It's a letter. And there's a picture of the baby boy, and by the time she had gotten to the hospital, the baby had turned enough to be born vaginally without any assistance. And so that was kind of one of the bigger miracles that has happened in our office.
Very cool.
It was really cool.
So let's go ahead and we'll go ahead and kind of close it down now. But why don't each of you take a couple of minutes and just talk about, like, if the people out here, what would be the one thing that you would want them to kind of take away from this experience about you and about your practice? And we'll close with Dr. Dalek. So we'll start with Dr. Lowe. How's that?
Okay.
All right.
The biggest thing, and what I would like people to understand, is there's always a way to make you feel better, right? There's drugs and everything else like that. And a lot of times those are quicker, but chiropractic's not a quick way. But chiropractic will instantly start helping your body heal better, okay? And so whether you've had surgery in those areas or not, an adjustment to the spine and adjustment to your nervous system is going to allow your body to start healing better. And over time, depending on how long you've had that issue, how long it's going to take to start healing. And so it's just a matter of time. You know, there's a reason why when you break a bone, it takes 4 to 6 weeks to heal. There's a reason why you sprain an ankle, it takes 4 to 6 weeks to heal. That's the process. And we don't work against that. We work with that and get that body moving the way it should. We work with athletes, like I said, and we do acupuncture. We do some things a little differently, but by allowing your body to heal naturally, the results are always better.
So for me, one of the things that I try to get across to every person that comes in, we do a lot of corrective care, like I said. So we're looking at X-ray to X-ray. We're going to check our work on that. But the idea behind that isn't just to do X-rays and make things look better. It's truly that these are 5 words. So you only have to remember 5 words. And it's proper structure equals proper function. And so when the structure of the spine is supporting not only your all the other systems, but your nervous system, that function is what allows us to be healthy and to express health, even when that looks negative. Like you said, sometimes we feel worse before we feel better. If you eat something today at lunch and it makes you sick, you're expressing health. You're not actually sick. You'd be sick if your body didn't recognize that and say, I need to get that out of here. So I want the structure of your spine there so that your nervous system functions in the best way that it possibly can to recognize what it needs to do, whether we feel good or not.
I intentionally named my business Aspire Wellness Living because I want to inspire those to look outside the box. I want people to be able to be inspired to do wellness. So look for the wellness in everyone and to empower what the body can actually do within the body itself. And I think that everyone needs some type of alternative care besides medicines and drugs because they're actually not going to heal you. We need to look into nutrition. We don't turn our soils like we used to many, many years ago. So our food system in America doesn't hold the food that we need. So we need to look for alternatives.
Excellent. Well, I want to thank each of these wonderful physicians, chiropractors, for being here today. I think you guys have heard that each of these guys has a little bit different approach to how they do chiropractic care. And that's the important thing. So as you go out and you're looking for a chiropractor, find a chiropractor that matches you, kind of matches your vibe and your lifestyle and the things that you're looking for. And you can see just by these 3 approaches that it varies quite a bit in chiropractic, which is really cool. So find your match if you're interested. Each of these 3 have a booth here. So find your booth, come talk to them, come and learn more about them. Let's give them all a big hand for being here today. And thank each of you, Dr. Dalek, Dr. McGinn, and Dr. Lowe. So thank you very much.
Thanks for having us. Thanks. Right. Thank you.